Welcome to ReSounding, a podcast exploring the power of the arts in advocacy and in action. We talk with artists and activists, taking a deep dive into questions surrounding the causes of displacement, the strength and the vulnerability of people on the move, and the potential of the arts to shine a light on social injustice and impact people's lives for the better. This month, I was joined by Christopher Bailey, the Arts and Health Lead at the World Health Organization, to talk about his work, his personal experiences, and the Healing Arts Initiative. Christopher, thanks very much for joining us in this second podcast.
Oh, my pleasure.
You know, the first time we met and spoke, which is maybe 18 months, 2 years ago now, I remember I was mainly excited, impressed, simply that you existed.
Well, you know, all of us should feel that way. We should all be impressed and excited that we all exist.
I mean, obviously, as an individual, I mean that, but also the fact that there's an arts and health lead at the World Health Organization. And the field of arts and health has a place within an institution like the World Health Organization, which is, you know, a bastion of evidence-based practice. It made me incredibly happy to know that. And then to meet you and feel inspired by you also was, I left that meeting very inspired.
Well, that's very kind of you to say so. And I've gotten similar reactions to people throughout the early life of this program from all over the world, which has been a source of inspiration to me, too, because it just underlies the fact that people want this to exist and are excited about it. But I also think it's a little bit deceptive to say that, you know, WHO is looking at the connection between arts and health as a new thing. To some degree, we've always looked at it. And, you know, even going back to the 50s and 60s, the arts, whether we called it that directly, have always played a role in our work, especially at the country level. And that could be introducing the DOTS program in tuberculosis in East Africa and using radio soap opera or using musicians, using storytellers at the community level to bring important health issues into the community in a way that could be understood, could be accepted as part of health promotion. So that aspect has always been there. But I think what we're doing now is taking that in a slightly different direction, a different dimension, if you will.
So those early examples you gave were really using the arts as a form of communication
Right.
for public health messaging, perhaps.
That's right.
So have you moved into different areas with the use of the arts now?
Well, yes. I think the use of the arts as health promotion, as health communication, is something that is non-controversial for WHO. We've been doing it forever. But another aspect to the arts, certainly, in the way it can be used in a health context, is some form of therapeutic use, where participating in the artistic experience in and of itself is a kind of intervention. So it's more than just the message that it's carrying. It's the actual artistic event itself has a beneficial health effect. And for me, there's two categories of that. There's the whole category of arts therapies, where there's an explicit intention to intervene with a patient using a mode of artistic expression. And then there is another area, which is the intrinsic health qualities of participating in the arts, whether it's consciously intended or not. And to me, that's a very exciting area. That's sort of the holy grail. When you think about it, using the arts as part of creating a healing environment is as old as medicine and the arts itself. I mean, if you go back 70,000 years to the cognitive revolution in the short history of our species, frankly, healing sessions, performance sessions, religious ritual, community creation were all the same event. They were all the same ceremony, and to some degree, over the millennia, of course, these different disciplines have split off, but they still share some basic common DNA. And I think the most powerful one that is shared, whether it's a healing event, a performance event, or a religious event, is this notion of compassion, where people come together to struggle together to solve a problem. And that's really what compassion means from the Latin, compassio, struggle together. And I think too often we look at the differences, and some of them are very real and important, between medical science, between the arts, between religious faith. But honestly, I find it very productive to look at what are the similarities. And one of them is community.
Yeah. Those kind of practices are really quite different in different places and different contexts.
Yep.
The way people understand music, the way people understand the notion of arts, as you're describing, arts kind of really as something intrinsic to the way people live, is in the example you gave there, that there's this ceremony which is part of life. It's part of how people make meaning of themselves and make meaning of their communities.
That's right. And I think it's important that when some people don't like the term arts and health, they would prefer creativity and health. And I totally get that, because in certain contexts, art already sounds distant. It sounds elitist. Or even worse, commodified. And when we talk about art, again, I like to go back to the etymology. Art comes from the Latin, which simply means skill or technique. So art, in my mind, is the creative act, but done with some skill or technique. And anyone not only can do that, everyone does do that, whether they realize it or not. When you arrange flowers at the table, when you sing a song with your family, when you come up with a good joke. I mean, that is creation with a certain skill or technique. And, in a family, a father might tell a joke, and dad jokes have arguable skill or technique to them. But I would say, being a father, that takes an incredible amount of skill.
To make your own family laugh is definitely a skill. But you're talking there about kind of everyday life, like arts are something which exists in everyday life, and I
That's
agree
right.
with you completely. Of course, that's true. Now, when I think of the World Health Organization, though, or I think of an institution that I would normally think of as advocating for certain practices or developing evidence bases. I know the great work WHO has done reviewing the evidence which exists for the role of arts in well-being. How
Yes.
do you line up those two things of your belief that art is something which is quite everyday in a certain sense, but also something that can be quite intentional and which can have an evidence base? How does that all tie together for you, and for the WHO also?
Well, let me give you a concrete example.
Yeah.
In the report that you're referring to, one of the trials that is documented in there had to do with a hospital ward that had blank walls and another hospital ward that had paintings. And they were identical in terms of their function, identical in terms of the kinds of patients that were on these wards. And they measured the cortisol levels, the stress hormones, in both the patients and the hospital workers. And what they found is that, with the only difference being the paintings on the walls, when you had paintings on the walls, the stress levels were measurably lower. So that's an example of finding a specific measurable indicator of a health change. And we know in that particular example that cortisol is natural when we're under stress. It helps us focus, it gives us energy, just like adrenaline. These hormones are not necessarily a bad thing, they're there for a reason. From an evolutionary point of view, they're there to help us cope with the stressors that we face in everyday life. But if we have these hormones for an extended period of time, our bodies are not set up to manage that level of stress over a period of time, and it can cause serious debilitation and degradation of our systems. So just for that measurable purpose, it's not the only benefit of the arts, but if there is a measurable benefit in reducing stress, you already have a significant measure right there.
That, to me, links really nicely to the focus of these podcasts and of the Art 27 network, which is focused on the power of the arts in advocacy, in action, particularly in relation to the causes of displacement, the strength and the vulnerability of people who have been displaced by war and persecution. And there's multiple challenges, of course, and multiple health challenges which can be induced from displacement, and extreme challenges, to understate it still. But I think, referring to what the anecdote you just told, the case study you just explained, I think one thing is being stripped of your environment, and therefore being stripped of some of those things which maybe would normally reduce your stress, that you lose access to maybe the arts or the visual environment, or some of the coping strategies that you would normally use, which can be linked to the arts.
Well, I think there's the issue of coping, there's the issue of stress and comfort, and that's one dimension of how the arts can help. But there's another dimension too, and that's using the arts as a kind of emotional triangulation, a sense-making ability to try and put difficult or unimaginable situations into context, try and create a meaning out of misfortune in an authentic way that means something to you, that can help you navigate a way forward. One of my favorite quotes is from the Swiss psychologist Carl Jung, who said, "Loneliness is not the absence of people. Loneliness is the inability to express what matters to you most." And I think when you're talking about displaced populations, part of the pain, and there are many, many dimensions to the suffering, but part of the pain is that nobody's listening, that they cannot tell their story. And that story can be told with words, that story can be told with images, that story can be told with sound, with movement. There are so many different dimensions that we've developed in the artistic genres to help us crystallize something meaningful for an individual, and better yet, for a community. Let me give you an example of one of the first projects that I was exposed to at WHO. You've heard of CERN. It's a physics institute that's here in Geneva. They've got the underground particle accelerator that goes around for miles.
Okay.
And they, a number of years ago, in an effort to increase the rate of discovery and innovation, started investing in the arts. And they had and still do, a wonderful program of bringing in musicians, bringing in artists, different kinds of creative involvement for these physicists, so that they could start imagining things that could then be tested and proved in order to spur creativity. One of the projects they had that I was invited to was a theater company that was composed of refugees from Syria. And they performed a production of Euripides' The Trojan Women. And in the original story that Euripides wrote, it was about refugees, these women who had been cast out of Troy without any knowledge necessarily of what happened to their husbands, their fathers, their sons, presumed dead, and a story about longing for their homeland and filled with deep anxiety about the future and what their lives would be like now that they've been separated from their homeland, from the men in their life. In this particular production, these Syrian women from all walks of life performed this 2,000-year-old text, 2,500-year-old text, in full burqas, and they interwove Euripides' ancient words with their own contemporary stories so seamlessly, you didn't know where the ancient Greek story began and the modern Syria story ended. And these women, although visually were identical on the stage in these burqas, you found out through their storytelling they came from all walks of life, on all sides of the conflict, and yet their common story of loss and regaining their identity was not only a unifying factor, but the effect of hearing these words so seamlessly interwoven with this Trojan conflict had this cathartic effect of realizing, oh my God, we've learned nothing. The power of this piece was not only for these participants to be able to tell their story to an audience that would engage and listen, but for us to be transformed and be able to see things and feel things from a perspective which before that moment was unimaginable to us.
Wow. Yeah. Because if I think of people's stories, especially, I think in many ways, but linked to migration, one thing that always strikes me with stories is that it's not even that people are not being listened to, it's that somebody else is controlling their story. That someone else is telling a story. The politicians are telling stories. The media is telling stories, which are not the individual stories. They're not even true stories often.
Well, let me give you an example of that. Two contrary examples. I had a colleague who was working in a displaced persons camp following the Balkan War, and there were a number of journalists there who. The woman's name was Lisa Russell. She's a filmmaker. And some of the other reporters who were there in that camp had heard that there had been a systematic rape of some of the women, and they wanted to cover that story. So they were brought in to this yard where the women had been assembled, and the reporters, through a translator, said, "Everyone who's been raped, raise their hand." And my colleague, the filmmaker, was so appalled by that moment and this notion of trying to harvest a horror story from people who had suffered enough. And maybe there was a positive humanitarian intention behind that, but the results, in this case, were further traumatization, honestly. Now, let's contrast that story with another project that is more recent. A woman named Hannah Thomas has been painting portraits of women in different settings around the world who have been who've had to manage events of sexual violence in conflict situations. And she did a series of portraits with Yazidi women in northern Iraq. The portraits are quite beautiful, but what made this project special to me was that whenever she painted the portrait, she also taught the subject how to draw, how to paint, so they could draw their own self-portraits as well. And the more she talked about that experience and the more she shared the stories of these women, the more I understood that, particularly in traumatic situations like sexual violence in a war setting, the last thing these people often want to talk about is the perpetrator, is the crime. What they want to talk about is regaining ownership over their bodies, over their identities, and rebuilding the fractured relationships in their lives. That's their story. And so the challenge for these arts interventions is to not take a journalistic approach of trying to get the story, but to authentically let the people that you're trying to help tell the story that is meaningful to them, what they want to tell, and to not force on them a narrative that you want to sell or you want to promote. That shouldn't be our job. Our job is to hand the microphone over, to give them the tools that they need to be able to express themselves, not to tell the story for them.
Yeah, and then the facilitation is so key. That's very skilled work you're talking about, and it involves. It's not short term either. That's long term trust building, long
That's right.
term working with people. In the story about the painting, I mean, to give someone also the skills to be able to paint and make an art represent themselves. That's really a long term piece of work.
Yeah,
For it
it's
to be
not an
valuable.
afternoon session. You have to
It's
be
not an
there.
afternoon 1
And
hour workshop.
no,
And when I'm reading any evidence base, if I'm reading any research, I'm always struck that behind the results is a facilitator, is a relationship,
yeah,
is a great piece of work if the results are good, which isn't always that clear in when I read papers or I read evidence reviews. I know each evidence review has its scope, and the World Health
yeah,
Organization one is very clear in its scope. It's not about facilitation methods. That's a different paper. But
yeah,
it's incredibly important, isn't it? How work is done, that people don't walk away thinking, okay, music does this or theatre does this. It's
yeah.
far more nuanced. There's far more that mediates those interactions.
Well, at the beginning of this conversation, we talked about how everyone practices art and it's part of our
Yes.
everyday life. And that's true. But that doesn't make everyone an artist. That means art is a part of everyone's life. Artists are a different group of people. Artists are those who have practiced their craft to the point where they've become masters of it. And those kinds of artists are the ultimate facilitators because let's face it, there is a difference between, everyday people singing a song and having a gifted person being able to raise up the quality and the connections of an entire community. And there is a magic there. There is a connection. And it is about
Mhm.
facilitation. It's literally allowing other people to not only use your talent to get to that place, but to ennoble themselves as well. I've lost my sight. I have terminal glaucoma. I have less than 5% of normal vision. And it was just before the lockdown last year when I was asked to perform a performance piece that I do called Stage 4 Global Stories on Empathy and Health at the Welcome Collection. Over the years, whenever I've performed, I've often sort of walked the streets, before a performance to relax, to move, to warm up, to get myself into the zone before I go up on stage. Um, and if I'm in a city, I'll just walk in the streets. And that particular day, I wanted to go to St. Martin in the Fields and catch a midday concert that was there. And I went to Trafalgar Square, and it was the first time I had visited it since losing my sight. And it was before the lockdown, so there were the usual crowds there. And because of my vision, I got terribly disoriented, and my heart began to beat. I began to sweat. I was having a panic attack, and I didn't know where I was. I didn't know how to get there. I couldn't see how to get there. And I ended up on the opposite side of the square next to the National Gallery. And I went inside more as a refuge than anything else. And I ended up in the gallery that had the Turner paintings, those monumental stormy seascapes. And it took me a moment to recognize them. But then when I did, I suddenly realized, oh my God, Turner paints the way I see. And for the first time since losing my sight, I actually could imagine my poor vision, the way I experience the visual world, as something that was beautiful. And a change happened. And it was this triangulation between the artist, the object, and the viewer that allowed me to find that meaning that didn't exist before that moment. It was that first moment when, rather than looking at my blindness as a deficit, as just a loss, I actually began to embrace it as something of a more heightened reality. That's the healing power of art.
Thanks so much for sharing that. You know, that's the rarest thing of a story genuinely changing how I understand something. Christopher, how do we harness that as artists, as organizations, as small institutions, as big institutions like yours, as grassroots activists? How do we harness what you're talking about for people that can benefit from that?
Well, I think there are many different ways. I actually think one of the pressing issues of our society today, and you see it on television every day, is this notion of people talking at each other, talking over each other, and not listening. I mean, one of the aspects of the arts is that if you are fully involved, you fall into this mode of deep listening and deep attention, where you not only connect with what that other person is trying to say, you actually begin to form the mirror neurons in your brain of feeling what they're feeling, of having that perspective. And that's a key step to finding mutual understanding, to building peace, to building community. And that's why the arts are such an important part of peacemaking.
I'm interested in kind of how WHO works with artists, because lots of people that listen to this are artists or activists. Is WHO currently working directly with artists, or is your work, is the organization's role more at policy level and research level?
Well, WHO, as a public health organization, our primary focus is research policy. To be most effective, we work with partners. But I also find that in order to understand the research, to have informed policy, you have to get your hands dirty. You have to go into the community and experience these events, participate as well as an equal. Otherwise it's all theory, right? And that's one of the reasons why, for instance, I signed up to a trainer of trainer sessions with Musicians Without Borders. It wasn't because I was going to go out and train people. That's not my job. But I wanted to experience how people did that, so that with the work that I do, I would have a more visceral, hands-on understanding of what the work was actually like. Mm-hmm. And the unintended result of that was that a lot of the techniques I learned with Musicians Without Borders, I actually found myself practicing in other meetings where I wouldn't have. There was a meeting right after that session where it was a meeting of scientists working on neglected tropical diseases. And I was asked to give the keynote address to that. And instead of giving the keynote, I stood up and actually used some of the techniques that I had just learned with Musicians Without Borders, and got all these scientists to get up on their feet and start doing body percussion and to sing a Rwandan folk song. Okay, I'd like you to stand. And put down your pad and papers and all of that, if you can. Now I want you to find some room on your abdomen, right? Now, try and repeat after me. Listen to it first. Now join in. Mama, hakuna mama, wakufanana, mama hawe. Mama, hakuna mama, wakufanana, mama hane. That was very nice. Now, what that means in Rwandan is, Mama, there's no one in the world like you. And you know, it's true. So what just happened? We woke up. We began to feel a little curiosity. What's going to happen next? We fell into a moment of deep listening, where it's no longer me lecturing about WHO strategy, but having to pay attention not just to me, but to each other. A sense of community was created. The beginnings of trust. And biochemically, according to the recent research, our heartbeats began to synchronize. And even the health markers in our bloodstream began to tick upwards.
So there's an initiative I know you're currently involved with, which is the Healing Arts Initiative, which I think does also work directly with artists. Am I right in thinking that it's supporting artists to be advocates and to strengthen their voice?
Well, this came out of, at the beginning of the pandemic, the UN actually invited me to be on a panel. In this session, we talked about, and this was the early days of the pandemic, how we thought the art world was going to be impacted by this and what changes were going to potentially happen. And the session was so well received that we began to get queries from all over the world. And one of the things that evolved from this was an offer from Christie's to do a fundraising effort where a section of their auctions around the world would be donated artwork from artists to raise money to help support the mental health response through the arts during the pandemic. I came up with the phrase healing arts to give it a bit of a brand. And part of it was this artist response fund that we were doing with a group called Culture Runners to fund specific projects in marginalized communities around the world that involved a community response to the pandemic or communities that have been hit particularly hard by the pandemic, which frankly is everybody. And so to give you an idea of one of the projects, there's one called the Ark Reimagined, and it's about these an artist working with the Marsh Arabs in southern Iraq, who not only faced genocidal hostility during the Saddam Hussein regime, where the marshes where they lived were systematically drained in retribution for their activities during the Iran-Iraq war. But then afterwards, the effects of climate change, the effects of the pandemic, especially with the weakened health system there, have driven a lot of the population away, and a lot of their cultural practices have almost disappeared. So in this art project, the idea was to rebuild these reed boats with this tradition that goes back thousands of years, and to sail the boats to the Venice Biennale, and to have a moment where these two areas, two communities, the Marsh Arabs of southern Iraq and Venice itself, both threatened with the effects of climate change, could have a dialogue about imagining a way forward that was more sustainable ecologically, more sustainable in terms of not only preserving cultural practices, but investing in them for the future. Mm-hmm. So it's that kind of thing that brings the community together, that addresses real existential issues in that community. And most importantly, it's the story that that community wants to tell.
Yeah. It sounds like an amazing initiative, Christopher. Is there any way that the listeners can get involved?
Well, certainly you can go to Healing Arts website and take a look at our London activation that we did. And we're going to have future activations in Paris in June and New York in September around the time of the General Assembly, having people involved in there. If you want to buy some art in any of the auctions, you should feel more than welcome. But I think the main thing about it is that it's not really about the fundraising. It's about the storytelling. It's about the engagement. So having people participate in these events, enjoying these events, and then bringing these ideas back to their communities, that's really what it's all about.
Christopher, thank you so much for joining us. Thanks for all your generosity and sharing your stories, sharing your experiences, sharing your knowledge. I found this an incredibly touching conversation, and it has meant a lot to me, and I've learned a lot. And as I said earlier, I've actually felt my understanding shift as I've spoken to you. So thank you.
Well, thank you. And my message to all of you out there is be safe, be creative.
ReSounding is brought to you by the Art 27 Network, a network of like-minded initiatives using art and culture to respond to the ongoing crisis of displacement of human beings in Europe and around the world. To find out more and to join our growing network, you can visit our website, art27.art, or follow us on Facebook at Art27. This podcast was produced and edited by Ed Holland. The theme tune was written by Matteo Gillespie in collaboration with Synca. Thank you for listening.